Hi, I'm Ranj Bhangoo. I'm a consultant neurosurgeon at the London Neurosurgery Partnership, part of the HCA group, and I'm also the clinical director for neuroscience at King's College Hospital.
What new and exciting treatments are there at the High Street Clinic and with London Neurosurgery Partnership?
So I think we're really fortunate at the London Neurosurgery Partnership that I can honestly say hand on heart that there's no neurosurgical service in the world that has the range of interventions that we have available. I think what's really important and people need to understand is that we don't just take something off the shelf if it's brand new or it's the latest thing. We really study the scientific evidence. We go away and review the technology. We'll do site visits. We'll work with the companies because a lot of companies actually want to work with us because clearly we're able to work with them to develop new technology. And then if we think something's appropriate, we'll introduce it in a very controlled and specific way. So a small group of surgeons will specially train on a particular technique. So in my area, particular interest, which is brain tumours, there are two really exciting technologies. The first of these is the Rosa Robot. Now this is a neurosurgical robot that aids the surgeon. It doesn't replace the surgeon, it doesn't do the surgery for the surgeon, but what it does do is that it eliminates some of the human error that you might find from micro movements in surgery to really increase the precision and the safety of surgery. And what we did, the reason that we got the Rosa particularly was because we wanted to marry it to the next exciting technology that we've introduced, and that's Visualase. So Visualase is, I think it's going to be a paradigm shift in the treatment of brain tumours. It's a minimally invasive way of treating many tumours that were previously considered completely untreatable. And it allows us through a tiny stab incision, so that's one stitch in the scalp, that's it, to treat quite deeply seated tumours with a fine, almost hair-thin catheter. So a very fine tube that's placed in the operating theatre that goes into the tumour with the aid of the Rosa Robot. And then we go around to the MRI scanner and in real time, using laser heat, actually heat up and destroy the tumour from the inside in a very controlled fashion. And the patient wakes up with nothing more than a single stitch. So this is very exciting treatment. I think it's opened up brain tumour surgery for a whole group of patients where the commonest conversation was, unfortunately you have a brain tumour and there's nothing I can do for you, to unfortunately you have a brain tumour but I think there is something that we can offer that will have meaningful impact for you but will not significantly impact on your quality of life or your physical appearance. So it's, I think, really exciting.